Good afternoon, everyone. On behalf of Indian Women Network Madurai chapter, I would like to welcome you all to today's session on decoding women's hormone. And we have a guest speaker, Dr. Ebenezer Rajadurai, sir. Thank you, Dr. Hema Satish, for arranging such session. And kudos to our health vertical lead, Mahalakshmi, and co-lead, Pravina, for always being a great support and doing great initiatives for our members. So Ivan was launched by Confederation of Indian Industry in the year 2013. So they felt that there should be a platform for women to empower them and enable them to participate, make them actively participate both in business and in the society. So Ivan focuses on majorly five verticals, namely leadership vertical and mentorship, health and well-being, advocacy and policy, and campus to career for the youth. We upskill the youth and make them industry ready. So under health and well-being, we focus on women health and lot of initiatives have been already done. So without further delay, over to lead Dr. Mahalakshmi to do the context setting
Good
and
afternoon to
introduce
all
our
of you.
speaker. Thank you.
Yeah. Good afternoon to all of you. I welcome Dr. Ebenezer Rajadurai, sir. He's a senior consultant physician, MD. He's attached to Devadoss Hospital. And I have already put his profile. He has more than 15-20 years of experience in this field. Directly going to the topic. Me and Punima, we thought in our forum, there are all most of them we are above 40, so mainly in the perimenopausal age. So our health is definitely a priority, and one only when your health is good you can carry out rest of the things in a good way. So in today's topic we will be discussing about the women's health and the hormonal influences on their daily activities, their mood changes, their behavioral habits, etc. So, in order to live a healthy and happy life, so what are the things we have to follow? So, this topic will be covered extensively by our esteemed speaker, Dr. Ebenezer Rajadurai. Welcome, sir. And you can, I think, start the meeting.
Thank you again for inviting me to talk on the session on women's health, how hormones play a role in with regards to women's health. I'll keep my talk small, and I'd be happy to take questions. I think that will be a more relevant discussion. With regards to women's health and decoding hormones, it's best to split the women's hormonal phases into four. So that's always the pre-menarche phase, or the when they are between when their periods is starting. So that phase where it is we'll say keep it between 8 to 18. Then there is a phase where which is known as the reproductive age group phase. There is a perimenopausal phase when the menopause is happening, and there is a post-menopausal phase. So I think with regards to women's health and the hormonal balance at each phase, so it needs to be addressed differently. So what are the usual doubts that we'll have with regards to the time when a girl is attaining her menarche? That is when she's going to start having a hormonal balance that is affecting her body and her uterus, ovary, and her periods. So usually at this time around age when the estrogen starts taking effect. So that's when the hormonal changes happen in the body. Usually the girls are aware of their self-aware, and occasionally there will be a mild weight gain, and there will be mood swings, which usually happens at the time of menarche. So at home, the girls who will be young girls, parents would be accustomed to them being very chirpy and listening to them, and suddenly they have their mood swings and you don't know what is happening to them. So usually at the time of menarche, when the estrogen starts kicking in, they'll notice that they are different from their own class boys. Yeah, they're different, and their body changes differently. So that may make them body conscious, so they might gain a little bit of weight, so they exactly don't know what is happening. So at that point of time, it becomes imperative for parents to understand what is happening with their girl child and educate her that this is a very good and normal process that is happening with her. So the bodily changes are happening, and at the time when her menarche is happening, that is when she's starting to have her cycles, the next worry happens. So usually all parents are worried because they are used to the mothers having maybe regular cycles monthly once, and there's this child who had a periods, first periods, and then is having very erratic menstrual cycles once in 3 months or sometimes once in 15 days. So they don't know if it is normal or if there is something abnormal with her hormones. So that is a very genuine concern, but most often it requires a good counseling and educating them that that is how the usual hormonal changes are during that period of time because of the effect of estrogen. Next, coming to the period of reproductive age group, that is between 18 to even up to 40 years of age. That is when there is action of both progesterone and estrogen, and what happens is the periods start to regularize, and other changes also happen in the body, which is what is the normal physiology of a young women. The next doubtful scenario, or where people have their doubts, happens in the perimenopausal age group. That is when their periods are going to start. So when that point of time, there is an unopposed action or an uncontrolled action of both estrogen and progesterone. So suddenly, the women who've been doing their routine lifestyle, family, children, suddenly they experience mood swings. Suddenly they experience increased sweating. Suddenly they have periods where they are depressed and they don't know why exactly that is happening to them. There can be a change. There can be a weight gain at that moment before the irregular periods even started. So it is important to understand that menopause actually starts much earlier before her period stop. So it is important to identify these symptoms because that means that she requires a lot of changes in her diet, a lot of changes in her exercise regimen to help her towards menopause, and because there are a lot of changes that happen at that time. And lastly, menopause. So there is always a feeling some among some women that okay, menopause has happened, all this periods problem is solved. But actually, the normal menstrual cycles protect the women against many odds that men are exposed to. So that includes heart problems, that includes bone weakness or osteoporosis. So once menopause sets in, the risk of a woman developing a weak bone or osteoporosis or developing a heart problem, suddenly her cholesterol and sugars will start to shoot up. So these are problems that start after menopause. So these are the normal hormonal changes that happen in the life of a woman across the 4 stages. Um, so I would be happy to take questions if anybody wants to raise in between. But I'll next topic that I want to address with regards to the hormonal changes is the diet concerns. So, what are the specific diets across each of the age group that would make a good difference in maintaining the hormonal balance? Uh, with regards to premenopausal or the menarche. Let's go start with the first stage. So with regards to menarche, where a girl is starting to have a period, so we might have a lot of children in a home who are at that phase. So at that point of time, there are a few things that needs to be addressed. First, the girl should not be anemic. So if the girl is already anemic and she's going to start to have her periods, there is always the problem where she'll lose her hemoglobin, or a hemoglobin will drop, she'll lose blood, and that will make her more weak. So ideally, it's best to have a baseline hemoglobin checked in children and adequate replacement. So we need to encourage them to take a good amount of greens, dates. If they are non-vegetarian, increase their protein intake also at that point of time. Second, because the girl, young girl, is going to start to develop her secondary sexual characteristics, breast enlargement. They're going to gain weight. Her fat is going to fat metabolism is going to change a little. It's good to encourage them to have a lot of fruits and vegetables, which will give a good amount of antioxidants. It's best to encourage them not to take fast foods because they do have an effect on the hormonal balances in children. So, the next important thing that with regards to diet is children at this point of time experience a lot of pimples and because of the hormonal changes. A lot of many times they are stigmatized and they don't want to these pimples to develop. So ideally, a good face wash regimen will actually help them. But there's no point in having a stigma with regards to pimples. It's because of the effects of hormones. Addressing it with a good non-oily face wash and, if needed, medications will actually help them at that point of stage. So this is with regards to diet and medications. With regards to exercise, a lot of times what happens is in our culture, when a girl starts having her periods, we start to restrict her to the home. Keep her inside, not allow her to play. Before that, she might have been playing regularly during the evenings. So we sort of tend to restrict the girl in our home. But it is important to note that this phase, that is between 8 to 14 or even up to 16, is the phase where girls grow the most. So if she's going to be at home at this particular stage, her hormones are going to, especially growth hormone, is going to get restricted, and her height and overall growth is also going to get restricted. So it's important to encourage them to have at least an hour of good physical exercise. So which might be a game, maybe play shuttlecock, maybe go for jogging, swimming, cycling is a very good exercise. So each of this is going to help her develop a strong bone, which is very important for a girl of that age. And it is going to give her a good height and a good physique. And more importantly, it will prevent her from developing weakness, especially with regards to the bone, because bone especially has to remodel. So it's only by continuous good exercise that a good strong bone is remodeled in her. So important to encourage girls at that age to have at least an hour of good aerobic exercise, which should be swimming, jogging, cycling, very, very, very safe and good exercise, or they should play a good amount of games. With regards to strength training, there is no contraindication to strength training, but we need to always keep in mind that uh, aerobic exercises every day with a minimal amount of strength training will help in the girls to regulate their hormonal balance and have a good growth phase, especially at the time of menarche. When it comes to women, that is between 8 to 40 years of age in their reproductive age group, when they are at their prime. So, what are the important things with regards to hormones that they need to address? Uh, with regards to maintaining a good hormonal balance, they need to have obviously a diet with a good amount of fruits and vegetables, which will give them a good amount of antioxidants. Uh, Especially in the pre-marriage phase, it will be good if they have irregular periods to check if they have a PCOS, that or a polycystic ovarian syndrome. Uh, Especially in the obese population. But being thin and having irregular periods doesn't mean that PCOS is not there. So PCOS is an hormonal problem where the ovary has multiple cysts, and because of the presence of that cyst, there is an hormonal imbalance. So especially when diagnosis of PCOS is made, once an ultrasound is done and you visited a gynecologist and the gynecologist said PCOS is there and your weight is more, then the best way to treat PCOS is for weight reduction. So weight reduction would involve a good amount of physical exercise, and that itself will actually improve the symptom of PCOS. Uh, and additionally, sometimes the gynecologist will have to prescribe metformin or other hormonal pills to regulate the periods in patients with PCOS. The next important thing is nutrition. So especially in the phase where girls getting married or they are going to work and they were little body conscious, they tend to, what do they tend to do? A lot of them tend to follow some fat diets without adequate nutrition, but that will actually affect their hormonal balance. It will affect their menstrual regularity, and there's a good amount of bone weakness and anemia that sets in them. So we have to advise the girls at that particular age group to maintain a healthy diet with good amount of fruits, vegetables, protein, calcium, especially milk with vitamin D, and also a good amount of legumes, which will have phytoestrogens. So all this will help them to maintain their weight and also maintain a good hormonal balance and menstrual regularity at this particular age group. Once they are planning to have a baby, it's very important for them to have two supplementation. One, folic acid supplementation, and next iron supplementation, because both will actually improve the chances of have them having a healthy baby. And at that point of time, hormones, especially during pregnancy, will have a swing with regards to estrogen and progesterone. So that is quite normal. Um, with regards to perimenopausal, so that is very important because a lot of times perimenopausal symptoms are not discussed. It is assumed that a lady in perimenopausal age group is having mood swings. It is assumed that she's just stressed because of the whole familial work issues or otherwise. But then a lot of times perimenopausal symptoms, if they are picked up early, so we are going to identify that the particular person is going to patient or a lady is going to go into a menopause. So it's important to identify and treat the symptoms. So what are the alarming symptoms and what are the normal symptoms? So normally the hot flashes can happen. Normally, mood swings can happen. Sleep disturbance mildly can happen. So in that case, it's good for them to have a little bit of relaxation, yoga, divert their mind with a good amount of aerobic exercises, Pilates. Yeah, all those are known, or multiple trials have shown that a good amount of yoga, Pilates have improving their hormonal balance at that particular point of time. Uh, but when do we need to address these symptoms with medications? If the perimenopausal symptoms are causing depression, if there is a severe depression that happens, if they are unable to concentrate on work, if they are not unable to concentrate on family, if they are having symptoms so bad that their sleep is getting affected and they're feeling isolated. So at that point of time, medication is indicated in patients or in women who are having perimenopausal symptoms, which would include supplementation of hormones also. But that is not the only therapy. Hormone replacement therapy is not the only therapy at that point of time. There are other medications called SSRIs, which also help them overcome this particular phase. It is also important to identify that phase, because that is when once a period starts to stop, bones become suddenly weak. So we see that a lot of women, they'll be so strong. We'll say, oh, such a strong lady. She's managing her home, she's managing her house, and she's doing all by herself. And suddenly, for perimenopausal, we see that she's unable to do her work because of a bad back pain or a severe body pain. So we see that what menopause does is Estrogen has a protective effect. By nature, that is, nature protects the women or the female of the species because it wants to continue the generations to come. So as long as the estrogen is there, and as long as progesterone and estrogen balance is maintained, the bones remain strong. There's a very less chance of them developing a heart attack or a heart blockage. But as soon as the hormone levels start coming down, the risk of a lady developing a heart attack and a risk of a guy developing a heart attack or a man developing a heart attack becomes the same. So perimenopausally, very important to check a few things. After the age of 40, make sure regular mammograms are done. After the age of 40, make sure at least one baseline cholesterol, sugar, thyroid levels are done. After the age of 40, make sure you have adequate calcium supplementation to prevent osteoporosis or bone weakness from happening after the period stop. And after the age of 40, make sure you are not at home taking care of children, managing everything, and not taking care of your health. You should make sure you have at least 30 minutes per day of aerobic exercise, which would include brisk walking, cycling, swimming, or even doing Pilates or doing a dance or even playing badminton. So make sure a good at least 30 minutes per day exercise regimen is there, because as I had mentioned before, bone remodeling keeps on happening even at this phase, and this is like an investment. It's like a 5-year fixed deposit. As soon as the symptoms start, perimenopausal symptoms start, if you supplement, do all this, that is, take calcium, do exercise, maintain your weight, and adequate supplementation, all that happens, then at the end of 5 years, once menopause happens, you will have enough reserve to last till you're 100 years old. So that phase is the most important phase in a woman's life. And next comes the menopausal phase. So what happens after period stop? So once period stop, there is weakness that can set in if you have not invested in your health before. So at that point of time, it is important again to continue the calcium supplementation. But more importantly, the other symptoms happen. That is, occasionally there is a risk of urinary tract infection because the vaginal pH changes. A lot of vaginal dryness can happen. So that point of time, it's good to consult a gynecologist. There are a lot of hormonal creams that are available that will help the lady to overcome those symptoms. And also post-menopausally, the risk of heart disease, diabetes, hypertension, that is high BP, cholesterol is same as that of a man. So it every year after your period stop, very imperative, because to check all this by a annual health checkup to make sure you are fit and healthy. So I think I have summarized the various hormonal changes that happen in these important 4 stages of life for women. I would be happy to take questions, because that will be a best way of us learning more regarding the hormonal changes.
Thank you so much. It was amazing to listen to you. So,
Thank
one, can you suggest few natural food which will regulate the hormones?
So diet. So let's concentrate on the most important phase where diets would make a big difference. That is perimenopausal. So perimenopausal is the most under-addressed phase in our population, because everybody is not happy to talk about it. So it's either they're not happy to talk about it, or others are not happy to address it. Even family members at that
What
particular.
age it starts at the
So
perimenopausal?
perimenopausal, okay, there are how you can classify is usually it starts around 38, 40. So actually it starts
Mm.
around 40, can extend even up to 50 or till period stop. Occasionally, some women have even up to 55 or above. But then a lot of at least this present generation, it's starting much early. So by 40, you should start thinking of probably that you're going to reach perimenopausal symptom surely by 45. So as I had mentioned, symptoms, it's very important to identify the symptoms. So a cool person who's doing all her work by herself and very comfortable with her life, suddenly starts developing discomfort where she's not able to concentrate in her work. So one thing is probably perimenopausal. Starts to develop body pains, starts to develop bone pains. Again, perimenopausal. So hot flushes can happen, and again perimenopausal. So these are symptoms to identify. Important foods actually is uh, phytoestrogens. Plant-based estrogens actually help us to ease the symptoms. So mainly present in flax seeds. So eating flax
Mm.
seeds every day, roasted flax seeds at that point of time has good amount of phytoestrogens. Legumes are beans, soya, and all that. They have a good amount of phytoestrogen. So I should encourage women at that particular age group to take good amount of these foods. These are the best source. That is legumes, அதாவது soya and beans and other category, and flax seeds. Flax seeds, not just that, flax seeds has good amount of omega-3 fatty acids also, and so it has cardiac protection, and it has lots of fiber, so it will keep the gut clean. So that is what I would encourage for that age group. That is perimenopausal age group. If I have to speak on one more important age group, that will be the young girls, that is 8 to 14. So that is one more age group where we tend to give in to their needs. So they will say, I want only lace and I want only ice cream and I want only pizza. But that's because they'll have their mood swings. So you don't listen to them, they will throw a tantrum. But parallelly, along with these little bit of these junk, predominant diet should include good amount of antioxidants, fruits, vegetables, but importantly, we should concentrate on their iron needs. So every day they should take dates. They should take good amount of greens if possible, every day or at least alternate day. And also iron supplementation in other forms might be required at that particular point of time. Second important need is their bones are growing. Actually, boys grow a little later than girls. So girls are actually growing earlier. So you have to encourage them to take milk, encourage them to take egg also is a good source of calcium. If they are non-vegetarian, a good amount of non-veg, or if they are vegetarian, good amount of vegetarian foods like soya. Soya is a good a source of protein. Green grams is an excellent source of protein. So moong dal. So
Done.
encouraging them to take moong dal. So all this will actually help them in their growth phase, because girls grow younger. So 8 to 14 is their main growth phase, whereas boys grow much later. Usually between 10 to 18 is their growth phase.
Actually, I'm basically an oncologist. So
Oh,
what I observe is, like as you mentioned, people take we advise diet and all other things. So nowadays, young patients, that is less than 40 years, cancer incidence is little bit very high. They are not even germline mutation is not there. In spite in 35, 38 years, they get CA. So do you recommend, or any studies are there to supplement, like to reduce the free radical damage? They are suggesting glutathiones, they are suggesting omega-3 fatty acids. So usually we recommend patients to take above at the perimenopausal age or after 50 years during their menopause. So is there any recommendation to take at an earlier age?
Um, with regards to omega-3 fatty acid, it's not just for reducing the risk of malignancy, but also for cardiac protection. It's good to take omega-3 fatty acids much earlier, madam,
Okay.
which I do encourage both with regards to diet and supplementation. Diet, we all know, all this flaxseed has, fish oil has, fish itself
Mm.
has. So they are good sources which can be taken, both vegetarian and non-vegetarian sources. Apart from supplementation, especially if they have a higher risk of inflammation that might be happening. So
Mm.
inflammation is sort of the core pathway
Mm.
for both
True.
atherosclerosis and oncogenesis. So it is a good way. I feel it's good to supplement. With regards to glutathione, uh, I'm not aware of much studies, but yes, glutathione is a good antioxidant. We all know, which can be started later if required. But I would still feel omega-3 fatty acids will be a very good supplementation to start early.
Okay, sir. Thank you very much.
There is a question in the chat. I'm going to read that question. This is from unknown user. So I'm 43 years old. My blood pressure is getting low by evening and I get tired by evening. Is it part of perimenopause? Sir, your answer.
43, I would say it is good to look at what is the average age group of menopause in the family. So usually there is a chance of menopause happening at the same age group as the mother or grandmother. So usually it has a pattern like that. But yes, there's a chance that it may menopause. With regards to low BP, you had actually checked and the BP is low, then we need to look at hydration also, madam. So we need to look at whether you're hydrating yourself well throughout the day, and because that also can cause low BP. But the symptom of feeling low, feeling tired, not able to do the same work that you would have been doing 1 or 2 years later. So that, yes, menopause itself can cause the symptoms. But as I had mentioned before, after the age of 40, I would advise you to have a few more tests, including your blood sugars and cholesterol levels, because all these metabolic syndrome also can cause the same symptoms. But if all that is not there and it is actually perimenopausal, a good amount of supplementation of phytoestrogens, all that food that I had told, black seeds, and supplementation with good amount of legumes, soya, that will actually help us to achieve a little bit more balance with regards to estrogen. And obviously, having a good relaxation regimen with yoga, Pilates, or going for a brisk walk, that itself will actually help, or cycling. So that also will actually help in mood elevation, and it might actually help to improve the tiredness that you have. Um, Apart, if the symptoms worsen, that is, if you're still feeling very low and not comfortable, then I would suggest to consult a gynecologist, because then rarely medications might be advised.
So from what age we can you recommend to take the supplements? The omega-3 fatty acid.
Omega 3. Omega-3 fatty acid is actually a good supplement that can be started much early. We can actually start it in the reproductive age group itself, but usually women in the reproductive age group are adequately supplemented. A lot of them are on folic acid, calcium, and iron. But omega-3, I would say, especially if you have a risk, arthrogenic risk, that is family history of heart problem or family history of dyslipidemia, especially in your parents or grandparents, first, or especially first degree relatives, that is brothers or parents or sisters, it's best to start at a much earlier age group. I would say in women, it's best to start at 30 to 35 at least.
Okay. 30 to 35, sir.
At least,
That,
at least.
okay. Thank you. Thank you, sir.
Earlier the better.
Nowadays, people attain menarche very early in life. So, what some researchers have shown that if they attain early menarche, then the menopause is way later instead of being earlier in life. Yeah, your take on that, Sim?
Um, Early menarche, yes, genetically, I think it's happening, but there are also other factors like our intake of fast food and other changes might be predisposing. We are still not 100% sure of why it is girls are attaining their periods much early or are attaining menarche much early. With regards to menopause, um again, the concrete can't say concretely because it happens early. Menopause will happen late. I mean, I don't think there is uh, concrete evidence, but
There was a research paper to prove it.
yes, but it is there. But probably secondary to our general hormonal balance or other imbalance because of it changes. Um, with regards to again, I think I just did mention one important thing: surgical menopause. That's one thing I wanted to say. So especially women who are going to have a surgical menopause, You have to plan a few things. One, the calcium supplementation has to happen early. We see a lot of women post hysterectomy come back to us with a very bad osteoporosis, with even fractures happening much earlier in their lifespan. So 45, they come with the fracture and there's osteoporosis, and you see that 35 years of age, they underwent hysterectomy. So adequate supplementation with calcium, vitamin D, and if really required, starting bisphosphonates early in that particular age group will prevent that complication that happens because sudden withdrawal of hormones in women who are undergoing surgery, that is the removal of the uterus and ovaries. So that is one important thing that also to address. And occasionally, because of the sudden surgical removal of uterus and ovary, they have hormonal changes. Rarely hormonal replacement.
I have a doubt. So taking this calcium supplements, will it cause kidney stone?
Uh, no. So the dose of calcium that we are using, that is 1 to 1.2 grams, usually wouldn't cause kidney stones, madam. So much higher dose, that is usually double or triple this dose, rarely can cause calcium deposition and kidney stones. But what we normally give to patients as supplementation during, say, for example, during pregnancy and during perimenopausal age group, or us just taking calcium tablets, Sandoz, or other supplements would not cause renal calculation
Okay.
or renal stones in patients.
There's a
Thank you.
member who has raised their hand to ask a question. Please go ahead.
Good afternoon, sir. Sir, what are the supplements that you would recommend for somebody who's undergone surgical menopause, sir?
With regards to surgical menopause, a few important things is one, as I said, suddenly the uterus and ovaries are removed, and so that causes hormonal changes, which includes bone weakness. So first thing to address, I would say, because actually practicing associated with orthopedics predominantly, so we see quite a lot of osteoporosis. So please supplement with calcium, vitamin D, and if still, and you will have to get a DEXA scan to see how your bones are within at least a year or two after the surgery. Because if still the bones are weak, then there is something known as bisphosphonates, which can be given to strengthen the bone. That is number one. Second, rarely if sudden withdrawal of hormones is causing mood changes, then hormone replacement therapy would be indicated. Good amount of omega-3 fatty acids will actually help, because what happens is once menopause happens, the as I said, the risk of atherogenesis, that is blood vessel blockage, diabetes, hypertension, something known as metabolic syndrome, increases suddenly in the women. So at that point of time, one, you have to screen for these diseases, and second, more importantly, supplementation with antioxidants, omega-3 fatty acids will also help in overcoming these symptoms.
There's a question in the chat box again. Somebody wants to know the side effects of birth control pills on hormones.
Um, so with regards to birth control pills, so there's a lot of myths and a lot of facts. So when do we use birth control pills? Obviously, you have to exclude certain risks before using birth control pills. That is, the lady should not have a risk of blood clots. So if she's had a DVT or a blood clot in the leg, or some history of stroke, or some history of heart problem, heart blood vessel problem, we would not want to start oral contraceptive pills. Uh, and we also don't want to start oral contraceptive pills if they have a liver problem. We don't want to start oral contraceptive pills if there's a significant family history of, again, this blood vessel issues, blockage issues. Population, if there's smoking involved, we want to avoid birth control pills. This is when we want to avoid. So when do we use birth control pills? So birth control pills are used especially to regularize the cycle, occasionally increased bleeding or menorrhagia, or severe pain during bleeding, during a menstrual cycle. So these are times when we would like to give oral contraceptive pills. And obviously, once during the time of perimenopause, when periods are very irregular and there is either an excessive bleeding or there is associated dysmenorrhea pain, we want to start birth oral contraceptive. So very important at all these stages to know that when it is indicated and when we have ruled out the complications, the effect on normal hormonal secretion is nil. So we are only giving it to help the lady. So it is not going to affect the normal hormonal secretion once we stop also. Once we stop the OCPs, a lot of misconception that you take OCPs, it will cause infertility. Once you take OCPs, it will surely have a lot of adverse effects. So if we rule out these adverse contraindications, that is smoking, blood vessel blockages, liver disease, and a history of family history of breast cancer or a genetic predisposition to breast cancer, all that is ruled out, we can confidently use oral contraceptive pills.
So
So,
what
from
is
a
the
perspective
average?
of a general physician, gynecologists might have a different approach towards these things. So, we have to keep that in mind. And sir is a very accomplished general physician and a diabetologist with expertise in different hormone treatments also. Like if you have any other endocrinological problems, you can ask questions like on thyroid and stuff like that. There's another one question in the chat box. If a person removes uterus at the time of menopause, will it affect our health in future?
Um, Actually, at the time of menopause, if uterus and ovaries are incorrect, thing is it's both coinciding with when the periods are actually stopping. So exactly at the time of menopause or a few years before or at that time, it wouldn't affect much. Wouldn't affect much. Even although it's a surgical menopause, it's happening coinciding with the time when periods are actually going to stop. So it shouldn't affect the health much. But as I keep on saying, ideally supplement calcium like a 5-year FD. Take your calcium beforehand so that post menopausally you are strong enough to withstand or rather avoid any bone related problems.
There's one more question in the chat box. Certain parameters that determines the woman is healthy upon the aspect of menopause.
Um,
I think it's diverged totally towards gynecology.
uh, yeah. So when we want to know whether you're healthy or even at the stage of menopause, whether you've done everything correct. I think that is what I'm understanding from the question. uh, so if you don't if you're sleeping well, if you don't have yes, so if you're sleeping well and you're feeling comfortable with yourself, not much of difficulty with regards to concentrating on work or concentrating on your leisure activities, and you're not having any bone pains, no back pain, no leg pain, knee pain, and your weight is balanced. There is no suddenly because of the hormonal imbalance, you've not gained weight, especially perimenopausal or postmenopausal. Uh, that means, and obviously, you're going to check the metabolic parameters that I keep. So, a lot of times, what happens is perimenopausally, everything is attributed to menopause. Nothing is being evaluated otherwise. So, make sure you check the sugars, cholesterol, thyroid, blood pressure, and obesity. That is your body mass index. So all that is normal. Then you don't have any problems at around menopause, or you're healthy at the time of menopause.
So when do you recommend to start general health checks? Like master health checkup is such a big thing, and everybody starts by 40 because everybody gets very responsible by 40. So is it enough to start at 40, or you advise to start a little earlier than that?
Um, there are two factors to emphasize on for with regards to health checkup. One is family history. So, if there is a family history of diabetes in the first degree relatives, that's father, mother, brother, sister, And there is a two generational families. The grandparents also have diabetes or hypertension or dyslipidemia. Start much earlier. Don't wait till 40. Ideally, there are a lot of guidelines, including WHO guidelines, emphasize start by the time you finish schooling and start college. Have a checkup at that time. Then, if you're normal, have a pre-employment health checkup to make sure things are fine. Second, don't wait till 40 if you have symptoms. So symptoms of tiredness, increased urination, symptoms of weight loss, symptoms of chest pain, or symptoms of palpitation, that is, you're feeling your own heartbeat. In that case, please don't wait till you're 40. Ideally, check early. So nowadays, the guidelines is for men to check at 35. By 35, you should have at least a checkup, and for women to have at least a checkup by 40. But considering we Asians, we South Asians have a very high risk for diabetes and hypertension, I would emphasize, based on the multiple guidelines, at least have your sugar checked by 25. Everybody should have their sugars checked by 25.
That's quite early and quite scary also, I guess. There's one more question in the chat box. Or two questions are there. I'll ask one by one. What is the normal hemoglobin range in young girls?
So the normal hemoglobin range with regards to young girls is it has to be between 12. 12 is an ideal number to remember, but 12 to 14 is a good hemoglobin range. Anything beyond 10, we can try nutritionally to pick it up, to improve it. But less than 10, the young girl requires iron supplementation. So 12, remember 12. 12 is a good number to have. That's the normal hemoglobin for young girls. And um, the next question is now I am 55. How long I should wait for menopause? As I had mentioned, there is a familial history also needs to be taken into account. So when did your mother, when did the grandmother have their menopause? So most often the age group sort of coincides, but 100% it's not like that. Most often it coincides. So you can still wait. There's not so 55. You can still wait for a few years till okay, initially it will become irregular and then it will stop. But in case the period stops and then a year or many months later there is one more episode of bleeding, then we need to be careful because there's something known as postmenopausal bleed. I'm just you're not having it, but as an anecdote, I'm just bringing it out so that everybody is aware. So if period stop, it stopped at around 50, and then 5 years later or 6 years later you have a little bit of bleed. Don't assume that it is menstrual bleed, because that is known as postmenopausal bleed. In that case, you need to get yourself immediately evaluated by a gynecologist. But 55 is a normal age to have periods, so you can still wait till it stops. Nothing wrong.
Okay, I have one more doubt. Suddenly there's a frequent urination is a symptom. So is it a problem or what needs to be checked?
Okay. So, if the frequency of urination increases, when somebody wants to pass urine more often than they already had, if it is just frequent urination, obviously we want to rule out diabetes. It's known as polydipsia, polyuria, and so you want to rule out diabetes. So you want to check your sugars. But if that frequent urination associated with burning sensation while passing urine, or when there's a slower abdominal pain, a pain in the lower part of the abdomen, or fever, or any of these symptoms, then urine infection is another possibility. So urine analysis test has to be done. So you can contact the physician or the nearby lab and get a urine analysis test done to make sure it is not infection. Uh, Rarely dryness. So again, when we're talking about perimenopausal age group, rarely vaginal dryness and the dryness around the area can also have this urge to pass urine, or discomfort while passing urine. But I would say still make sure you check the first two things. That is diabetes. Make sure sugars are checked and make sure urine analysis checked to rule out urine infection or diabetes.
Okay. Okay. Thank you. Thank you, sir. Question in the chat box. Doc, can you read the question because I'm
Yeah.
attending this from the phone?
Yeah. The
Face sagging and hormones.
um, you didn't put all
Face sagging and hormones. I think they're asking how hormones correlate to face sagging.
can't put all the blame on hormones with regards to face sagging.
I think once the hormones in ladies, the estrogen comes down, then there is a loss of fat, which causes the sagging, mainly postmenopause in women. That's where fat fills come in, cosmetically, they
Yeah,
end up doing those things.
I think Madam will be a good person to answer that.
So please go ahead and
No,
we
Madam.
like your inputs also on
That is
that.
your expertise. Yes, as Madam has mentioned, correct. Apart from the other issues also that can cause, but as I had mentioned, Madam being a cosmetologist will be a better person to comment regarding.
As one ages, fat loss happens all over the body. It doesn't happen in the stomach, You tend to add more fat in the stomach because that's how the system is programmed to be. So the loss of pad of fat on the face is the first thing to happen. And that's why you see the sagging and you feel the face shrink down and you feel that the person looks old once you look at their face. And it happens in women around postmenopause because hormones have stopped helping. And once the estrogen level comes down, this steps in.
So thank you so much, Doctor. The session was very informative and useful. I think many of them has cleared their doubts. So thank you for accepting our invite in spite of your busy schedule. Uh, Thanks to Dr. Hema Satish and Devadoss Hospital for arranging this wonderful meeting. And once again, thanks to the health vertical lead Mahalakshmi and co-lead Praveena. And looking forward to such wonderful informative sessions in future. Yeah, thank you all. Thank you all for joining and being a wonderful audience. Thank you. Can we all switch on the camera so that we can take a group pic? KPS, can you take one group picture?
Sure, sure.
And thanks to KPS for organizing this meeting. Thank
Thank you,
you
ma'am.
for
It
the
was
coordination.
thank you, ma'am.